Welcome to this month's AHIMA High Five podcast. Kate and I have a special episode for you all. Whether you were able to make it to the AHIMA25 conference in Minneapolis, or whether or not you viewed us virtually or hoping to get a slice of understanding of what it was like on the ground, Kate and I are going to be able to bring a bit of AHIMA25 to you. Kate, what can listeners and viewers expect in this month's episode?
Absolutely. We had some really great conversations with those on the ground at AHIMA25, including session panelists talking about what's happening in Congress with SDOH, to AHIMA members and advocates who are there to support advocacy and really make sure that AHIMA members knew what's going on in the federal policy space. We also had some great conversations at our food packing event on Wednesday. So we're really excited for everyone to see what went on at AHIMA25 and really, get a taste of what it's like to be there on the ground. Andrew, why don't you kick us off?
Great, thanks. Yeah, we're going to be kicking it off with a conversation that I had with our Chief Public Policy and Impact Officer, Lauren Ripplinger. So we're going to go ahead and jump right on into that, and Kate and I will be back in a little bit. Great. Well, we're here with Lauren Ripplinger, the Chief Public Policy and Impact Officer here at AHIMA. Lauren, it's so great to talk to you about what's on the ground here in Minneapolis. How excited are you to be at AHIMA 25?
I am thrilled to be at AHIMA 25. Really looking forward to having our members experience all the different sessions that we're going to have here related to public policy.
And it's been a really busy policy year. There's a couple policy tracks going on.
Yes.
We're doing a couple sessions here at AHIMA.
Yes.
What makes you so excited about talking about policy here at AHIMA 25?
You know, I think it's a chance to kind of bring Washington to Minneapolis. And folks that may not always have a chance to go to our annual advocacy summit, they can come here and learn about what's happening in Washington and ultimately what impacts their day-to-day life and the work that they do.
And we are finishing Wednesday with a little bit of a Data for Better Health event.
Yes.
Can you talk about what we're doing?
Yes. So last year we launched our first ever Data for Better Health impact season. What we recognize is if we're going to improve the collection, sharing, and use of social determinants of health, we have to make sure that that transformational change is happening at the organizational level. So on Wednesday, we will have a set of volunteers joining us to food pack for a local food bank, Second Harvest Heartland in Minneapolis. U.S. Hunger will also be joining us that day. And we're going to have a bunch of volunteers that will pack these food packs and then take it to this food bank later on in the day, and which really goes to the mission of Data for Better Health and how do we improve and addressing issues like food insecurity on a day-to-day basis.
Well, Lauren, thanks so much for taking time to talk to us. We're really excited to be able to talk to you here at AHIMA 25, and our members are going to be excited to be able to engage with us moving throughout the year.
Absolutely. Thanks for having me.
I'm joined here by Lauren Montwell and Keith Allen talking about social determinants of health. Lauren's at United Health Group and Keith's at Fairview Health Services here in Minneapolis. We just wrapped up a great Data for Better Health session talking about social determinants of health. Lauren, let's start with you. Why is social determinants so important to you?
It's such a critical conversation to be having right now. It's important for our physicians to understand what the unique needs of patients are, and it's also important to look at the entire population and make sure that the health management programming that's available to those patients really reflects the needs of the entire practice or health system.
Keith, how about you coming from the provider side of things? Where does social determinants of health fit into your work?
Well, it helps us look at the full picture. It's just not one thing. It's just not about how my health is. It's about transportation. It's about food. It's about access to shelter. And it's about economics. So all these things together creates a better person.
We talked during the session, and you both hit on it, was why it's important to partner with your HI staff and both your organizations. What is partnering with AHIMA able to help you all do? Why is it important for you to partner with AHIMA on SDOH issues?
Well, this is about data, and so ultimately we have to be able to show and tell the story in many different ways, and being a part of this conference is put us in a room with people who are actually doing this work of determining the questions and showing out how we tell the story of the work we're doing on programming side.
Lauren, how about you?
It really helps us understand what the cost-benefit analysis of this work is. I think that has been part of the conversation from the very beginning, is how do you show the value of health-related social needs and social drivers of health? And the audience today is the right audience to be able to help us with that math.
It was really great to get both sides of a conversation about the provider side and the health insurance side as we talk about such important issues. So thanks both of you for being part of our session and working with AHIMA. We look forward to the continued work we're going to do on Data for Better Health. Thank you both.
Thanks for having us.
All right, so we're here at the AHIMA conference with Catherine Wickenhauser from Direct Trust. And Catherine, I want to ask you, what have AHIMA and Direct Trust worked together on recently? And
Sure.
what are some of the issues that we're seeing?
Sure. So Direct Trust is all about building trust in health technology. So we are very happy to have a partnership with AHIMA. And one of the things that we're most interested in, have been supporting AHIMA with, is the Patient ID Now Coalition. So we recognize that patient matching is critically important to the future of interoperability and how we exchange data. And we know that the work that's happening in the coalition is extremely important. So we're supportive of the Match It Act and everything that your team has been doing to really normalize the conversation around patient matching and then see what our next steps there are.
Great. And so as we're here at the AHIMA25 conference, what are some of the conversations you're hearing around health information
Sure.
and what's going on in the space?
Sure. So related to the Match It Act and patient matching, that seems to be coming up a lot. And one of the things that Direct Trust is working on is a standard around a voluntary identifier for patient matching, so privacy enhancing health record locator service. So that is kind of taking the concepts of what I'm hearing here around patient matching and applying that in a voluntary way. I think the other thing that I'm hearing is more about how health information professionals need to have a seat at the table. And so for those professionals who are in their organizations, that it's critically important that they help lead the implementation of efforts around interoperability, and that perhaps working together among different organizations like AHIMA, that we can help provide education, talking points, additional background and context for those health information professionals to go and really make a difference in that implementation of real world action and interoperability.
Great. And so one more question.
Sure.
Why do you come to the AHIMA conference?
Sure. So I've been coming to this conference for a long time, and I love it. I think AHIMA does a really great job of keeping a pulse on what's going on in the industry and equipping health information professionals to do their jobs. And so for me, it's really interesting to come. I work with a lot of vendors, but to actually come and meet with those people who are in the healthcare delivery organizations or other technologies too, and see what their day-to-day life is like, the issues that they're encountering, and the places that we can help as a nonprofit association and maybe partner with nonprofit associations like AHIMA too. That's really interesting to me. So I love hearing what's going on in a real world context from this conference.
Absolutely. Well, thank you so much, Catherine. We're so excited to have you here and talk to you today.
Thank you, Kate.
Great.
All right, well, I'm joined by Josh Mast and Sam Birch. They just came off the stage working with us, talking about regulatory affairs and giving us a regulatory affairs update. Josh is at Oracle and Sam is at AHIP. We had such a great conversation on the number of issues happening in health IT today. Josh, what's really important to you in the health IT space, and why was it important to come talk to AHIMA members?
So, I mean, health IT has I think, dominated my life for the past like 15 years. So all of it seems very important, but really trying to sort through some of these issues. You know, we've been working on interoperability for years and trying to figure out how to actually continue to move that forward, and you know, where are the roadblocks still and how do we get around those. So to me, I mentioned it on the panel, one of the big things is computable consent and trying to stay on top of that.
Right. Sam, what's so important about working with AHIMA members from the AHIP perspective?
So AHIMA members are on the front lines, right? None of this works, right, without the people in the room. So being here, being able to have the conversation, and these are not all easy conversations, right? But having the right perspectives and really understanding what the front line needs to be successful is why I love coming to AHIMA conferences, and everyone is so nice. That would be the other thing.
We'll keep working with both Oracle and AHIP over the next year as we work on some of the really important issues, whether it's electronic prior authorization or the future of interoperability. But Sam and Josh, thanks so much for joining us.
Thanks for having us.
Thank you.
Yeah.
I'm here today with Susan Clark, one of AHIMA's biggest advocates at AHIMA25. So Susan, what have you learned so far at AHIMA25, or what are some conversations you're hearing?
Yes, I always keep an ear out for unusual things that are going on that maybe aren't making headlines or aren't in our white papers that we're reading. So one of them, I had the great fortune to speak with our past president, Catherine Lusk, today on interoperability, and person came up afterwards and was asking questions about how to navigate school-based healthcare information sharing, because they're also dealing with FERPA and minors and trying to then be an advocate for how do we improve health information in these, which the company I've been working with now, Converge Health, that's last mile interoperability is our jam. So it made me think, how do we get that into the ecosystem of health information, and what do we need to do to help move that along, because we've come so far.
Right, exactly.
Yes, and then, do you want more?
No, that's great. So, Susan, I want to ask you, why is it so important to you to be an advocate for the health information profession?
Because our academic foundation is so transferable along the continuum. So our people know business and compliance and clinical and tech, and so we sit in the middle of everything, and I think there's just such an avenue for that to advance all of the underpinnings of what we're moving towards with AI, what we're moving towards with tech, and reducing burden for our clinicians, and improving policy all along the continuum, and revenue cycle. How do we make our payment systems more efficient and effective? So that's what we do. So how do we help upskill too? So how do we keep making our membership even better and stronger and more marketable?
Absolutely. Yes. Well, thank you so much for coming to conference, and we look forward to seeing you at Advocacy Summit next year.
Oh, I will be there.
Great.
We're here with Dee Davis from the Sequoia Project, talking a little bit about data usability taking root. You had a great session today talking about data usability taking root. AHIMA's a really strong supporter and co-sponsor of the movement.
So happy.
Why is data usability taking root important?
To me, we need to really think about healthcare IT usability and the quality of the data to be able to harness the power of the health IT systems to actually make them usable, to make them semantically interoperable, so we can harness AI and clinical decision support. But we also need to make sure that we think about those workflows that need that redesign. All these wonderful HIT technologies have these APIs, as people are calling it, built in, but nobody's operationalizing them necessarily in the optimal ways. So we're trying to help everybody understand that they all have a part to play.
Even I myself coming into it was a little intimidated. It's pretty heady, it's pretty technical. Why is it important to have data usability taking root at AHIMA25? And if someone wants to get involved, how should they jump in, even if they are intimidated?
Great question. We're all change agents. We need to capture those people at that last mile, those people that truly affect the change in their organization. They understand the workflows that their clinicians need, whether it's a provider practice, a hospital system, a payer organization, whatever that walk of life is. There's something data usability in all those, because all that together will bring the ecosystem to allow us to have that learning healthcare system that we need to do.
Great. Thanks, Dee. Thanks for talking with us. We look forward to continuing to work with you in the future.
Thanks for your support ongoing. Thanks so much.
All right, so we're here at AHIMA25 with Alia Suleiman from Datavant, who is one of our congressional panelists today on talking about what's happening in Congress and at the federal government level. So, Alia, what were some of your takeaways from today?
While we talked about how much is in limbo because the government is not open currently, and I think the big thing to note was that we saw a ton of very just sweeping action come out of the reconciliation bill earlier this year. But when it comes to major policy overhauls or consensus building on key issues like privacy or artificial intelligence governance, we're probably a little ways away from seeing meaningful activity on those fronts. With that said, I think everybody is getting ready for election year posturing, whether it's through riders or appropriations add-ons or other more symbolic legislation to kind of have members show everyone in their constituent groups where they stand on issues.
Great. So if there's one thing that health information professionals should take away from AHIMA25 in general, what would that be?
I think it is that do not sleep just because the federal government is shut down right now on all of the other activity that is happening at the regulatory level and across states. It has been a huge theme in my conversations at the conference so far that
things are getting complex and things are feeling like it's feeling like there are more and more accountability points for organizations than ever before, and all that while you're still trying to maintain trust with your patient population and make sure that you're serving them in the ways that they deserve. So it is unfortunately sounding like it's only going to get more complicated, especially as things restart and we kind of digest everything that came out of state legislative session. So the message is be vigilant, stay vigilant, and continue to try to map all those various accountability points for your organization.
Great. Well, thank you so much for joining us today.
My pleasure. Thank you.
Great.
Hi there, everyone. I'm Sarah Gerke, Program Specialist at AHIMA, and I'm joined with Sue Nathy, Executive Director at MINHIMA and GHIMA. So Sue, can you tell us a little bit about what we did today?
Yeah, so today we had the exciting time of filling food opportunities for the homeless and hungry here in Minnesota. We were able to fill over 20,000 meal packages. Each package feeds about 6 people, and so we will see thousands of people benefiting from what we did today. So we are so proud that we could help and be here to do that.
That is awesome. So tell me, what does this kind of work mean to you?
You know, I'm all about giving back. That's been the number one thing since I started in health information. I help teach, I mentor. I want to make sure that we have the opportunities available out there for people. And you can't learn when you're hungry, we all know that. We always tell people, go get a snack or something. But we want to make sure that we're providing those opportunities to others as well.
Awesome. And how does this work tie into what you do at MHIMA and GHIMA?
So volunteering itself across the state of Minnesota is huge. Many of our health organizations have volunteer time set aside for employees to actually go in. We have the Ronald McDonald houses, we have the Children's Care Center, things like that. So it's a big component with the work that we do here in Minnesota, and we're just pleased that we could have you guys assist us here from a AHIMA level and have our national convention here to share with everyone this experience.
Well, thank you so much, Sue, for your support and all of the great work you guys did today with us.
Thank you guys.
Well, the food packing event was great. It was such a great opportunity to be able to give back to those in Minneapolis, which was such a great host for this year's AHIMA25 conference. Now that it's in the books, it was another great year, another great conference here at AHIMA. But if those of our membership that is interested in coming to our next event, our Advocacy Summit in March, how should they go ahead and get involved, Kate?
Yeah, so we do have our Advocacy Summit coming up March 16th to 17th of 2026. So we're really excited. Registration opens soon. Keep an eye out in the advocacy newsletter for when that registration opens. Make sure to go to our Action Center to sign up for the newsletter if you aren't already. And we really look forward to seeing you at our next event. Thank you all for being with us here to hear about AHIMA25 and all the great work that our members are doing. And we look forward to seeing you at our next episode.